But let me start off with the NHS and NHS reform. You have a huge project ahead of you. What did you make of your predecessor Jeremy Hunt's analysis of the number of unnecessary deaths in the NHS and the job to be done to bring that number down?
Well, I think Jeremy did a fantastic job, and I think on that analysis, he's right about, of course, there's been unnecessary deaths. I've had to sadly respond recently, for example, to the Donna Ockenden report into maternity care, and that showed once again, how long this has happened over successive governments, and more needs to be done. So, today it's exactly a year since I walked into my department as the Secretary of State. As you all know, it all began with that camera on the ceiling, and there I was in the department. And it's I have to say, Andrew, and obviously we've talked often in when I've been in different roles, but this is the toughest job I've ever had. It's clearly one of the most important jobs I think anyone can have in government, and that weighs on me every day in terms of whether it's the issue you've just mentioned, the important issue of unnecessary deaths, but having gone through this pandemic and the work that lies ahead, it's something that requires every effort that I have.
We often talk about the NHS as this huge monolith, but people who work inside it tell me it's much more like an endless series of kind of semi-autonomous people's republics, only loosely joined at the centre. How does it feel to you at the centre?
Well, not quite that bad. As a department, obviously the biggest department there is, however you measure it, whether it's number of people, and when you add all the people in the NHS, for example, the size of the budget, probably also the most complex department to run. But we can make change, and I think we're making some positive change. Although the pandemic clearly has been, I think, easily the most challenging time in living memory for anyone working in health or care, and the people working out for the health system have done the most remarkable job. I think it's also an opportunity to make some big changes that perhaps needed making anyway, but now because of the pandemic, people can see just how stressed the health system is and maybe be more accepting of the kind of change we need to make to keep the NHS what we want it to be, which is those values of 1948, free at the point of use there for all of us, world-class healthcare, but looking out forwards towards 2048 about a modern health service.
You want to make lots of changes in a digital NHS and the rest of it, but out there around the country, huge numbers of people simply can't get a doctor's appointment. Vast parts of the country, you can't get an NHS dental appointment for love nor money. Do you have the money? Do you have the resources both to make the changes you want and to ensure that people are getting basic levels of care for the next year or two?
Yes. The NHS budget is the biggest it's ever been. The biggest it's ever been in history. It's rising by record amounts. We've even created a new levy to help fund that and social care. And so that is, I think, in a very good place. But to get the level of service people rightly expect, whether it's in dentistry or primary care or A&E, wherever it is, that it requires reform alongside that. It requires change. We need to modernise and new ways to do things. And it starts from everything in terms of you getting the right leadership across the trust. We have some fantastic examples of leadership in NHS trusts. We also have some really poor examples, and like any organisation, you need good leadership, the right culture, and that's why I had the independent Gordon Messenger report, and I've accepted that. It needs investment in technology, better use of data. It needs more people, of course, as well, and I accept that, but it needs action across all those fronts and more, and that's about reform.
How worried are you about a big doctors' strike later this year?
Look, I've seen some of the recent news about some of the trade unions saying that they may call for industrial action. Look, that's a decision for them. I think as long as we approach things...
There's been a vote, so it does look like it's going to happen.
No, there's been a vote of an sort of executive committee. There's not been a vote of the membership.
Members, no.
And that's very different. I mean, in the past, if you're talking about the BMA, they have had votes before that have been called for, but there's no industrial action. Look, the important thing is, though, obviously that's overpay. I think we approach pay with fairness and thinking about it very carefully, and hopefully people take that seriously.
Looking at all the challenges that face you in the NHS, what is the single biggest thing that keeps you awake at night? Maybe you'll say nothing keeps me awake at night, but if something did, what would it be?
It's, I think it would be making sure we can get the right workforce in place. The number of the people that we need. I've commissioned the NHS for the first time ever. The first Secretary of State asked for a proper long-term 15-year strategic workforce plan, and that is essential, because at the end of the day, the NHS is all about its people. Of course, we need these changes, we need the culture change, we need the technology, but it begins with the people in the NHS, and at every level, no matter which level they're working in, they're all crucial to success. And we have a shortage of people right now. We've got record level of vacancies. Despite that, we're recruiting at the highest level ever. We've got more doctors and nurses than ever before. We've got more doctors in training in medical school, for example, and nurses in training than ever before. But that is...
You have to increase the number of doctors in training, don't you? There's a big problem there.
Well, we have increased, and we're trying to go even higher than that. We removed the caps in university for medical schools for the last 2 years, and we're trying to continue that recruitment at record rates.
You shared a very painful story with the Sunday Times last weekend. About 4 years, I think, since your brother took his life. Can I ask you, in the context of that, how seriously you feel that mental health services, probably particularly for kids, are falling behind in this country? Because I know of so many people who've got children with serious mental health problems who really can't get the treatment they desperately need.
I think clearly the investment we're making in mental health, which started before the pandemic and has continued, is record levels of investment, and that's important. But I think we need to go further in terms of what we can offer, not least because the pandemic sadly has made the mental health situation more challenging for so many more people, especially younger people. That is why I'm doing a new 10-year mental health plan. Alongside that, since you mentioned suicide, I'm also doing, as part of that, a standalone 10-year suicide prevention plan. And I'm saying sort of 10 years because I think these to be properly long-term, and they have to also, the offering, if I may say so, it has to be cross-government, because one of the things I've learned in the privilege of having so many different jobs in government, that there is, when it comes to mental health, when it comes to health prevention more generally, and promoting better health, there's a job for every government department. Of course, my department, mental health, takes the lead, but whether it's the Department of Education, it's the DWP, it's the Treasury, they all got a role to play, and this is the first properly cross-government mental health plan.
And is this personal for you?
Yes.
Right. Let me ask you about wider politics, if I may. We've done a bit on the health service. You stood against the current Prime Minister in the leadership election. Close students of politics might have spotted that you didn't win that one. Had you won...
I don't know. Did you spot that?
Had you won it, would Number 10 have been giving parties during lockdown? Do you think it would have been the same atmosphere under a Sajid Javid government?
I'm not going to speculate about what didn't happen. But clearly, the parties that you're referring to. I mean,
I'm not going back to the parties. I'm really asking about you, because you seem to be somebody with quite a strong moral core, and I wonder, candidly, whether there's been any moment when you've looked at this Prime Minister and had second thoughts or doubts. It's a small, non-leaking, private, friendly gathering. You can be as frank as you like.
I've certainly, I think, like many people, looked at some of the goings-on in the parties that you've mentioned, and I was really upset about those. First, they were reports, and they had to be looked into. I think that people across the country that were upset about what they heard, what they saw, then what was then later confirmed by Sue Gray's report, they have every right to be upset by all that. And it's right the PM commissioned this report. It's right that the police looked into what they wanted to look into. It's right, absolutely right, the Prime Minister came to Parliament and apologised for it.
And without going all David Attenborough, can the leopard change its spots?
Yeah, look, I think the Prime Minister's already made significant changes, and those and those changes I think are already making a difference. But in terms of what do I what am I doing? I've got a really important job. I think it's really important, and it's a privilege to have this job at this time, especially sort of after this pandemic, and I'm giving it everything.
Would you serve under Jeremy Hunt?
I'd serve under, I think, any leader that was democratically elected by my party.
Okay.
If they wanted me, I would. Very
interesting. Good. Okay. Let me ask you, we've talked about dentistry.
You can ask Jeremy Hunt later on who he'd serve under.
Absolutely. I noticed he voted with the government on the Northern Ireland Protocol yesterday. It was an interesting moment. At any rate, we've talked about dentistry. We've talked about all sorts of aspects of the healthcare and mental health. What about care for women in the health service? I mean, the word itself has become problematical for some health trusts and so on. There's debates about what the language you use. Just tell me a little bit about your view on that.
Yeah, look, it shouldn't surprise people that as a Secretary of State for Health, I think someone's biological sex is important in terms of giving them the health care that they need. So if it's women, and we're talking about ovarian cancer or cervical cancer, if it's men, if you're talking about prostate cancer, for example. And I think if you remove the word women or men, for that matter, when you're trying to explain a health issue, then you're not helping those people, the very people you're trying to help. So I think whilst language, we should be compassionate and sensitive about issues around gender language, we shouldn't be shy to use these words at all. And recently we have had some incidences where, take ovarian cancer, where NHS Digital, that part of the NHS, changed some of the descriptions that they had online, and I think that was wrong. They've now changed it back, so I made my views clear. And I think it is important to, when you talk about health issues that impact particularly women or men for that matter, I think you've got to be very clear with your language, because your biological sex matters, and that's what this is all about. It's about looking after people's health based on their needs.
Let me ask you one further political question. I know you want to get on with your job and think about the NHS and nothing else, but this is not a trick question. I'm not trying to be silly about it. But if the Privileges Committee decides the Prime Minister has knowingly misled Parliament, do you think for him that is it?
There's a proper investigation going on. I don't want to interfere with it as a minister, so nice try, but I'm not going to answer that question.
All right, well, I've done my best, so I'm hoping there are plenty of people here with clever and better questions than I've come up with. Can you raise your... I think there's a microphone or two. There's a gentleman over there. Can we get a microphone to him, please?
Why do we deserve a pay cut?
That's a question that an awful lot of public sector workers, I think, would be interested in an answer to. That, we clapped them. They've had a long period of pay freeze, and in many cases they've actually fallen well below inflation now. Why should they put up with that?
Well, I think whether you're a public sector worker or you're a private sector worker, I want to see people being paid fairly. Of course, as a government minister, we're responsible for public sector pay, and it's about fair pay. So if we think about what I'm responsible, which is the largest workforce in the country, the NHS alone, some 1.2 million, it's important to make sure that we are being fair as ministers, being open, transparent, and being fair. Last year we had a public sector pay freeze. I think everyone understands why that was. I think it was absolutely necessary, but it didn't apply to health workers. So they got a rise of 3% when everyone else in the public sector saw 0%. This year, of course, the situation changes dramatic with the global inflation. We're seeing inflation 9-10% maybe, and that is significant. And the way I will approach this is by studying carefully what the independent pay review body gives to me as the Secretary of State for my workforce. And that's what I will be led by. And that the job of that pay review body is just that, to take into account inflation, to take into account general earnings, to take into account retention and other issues, and then report back to ministers. I think that is a fair process.
Looking not just at the RMT, but across lots of other unions, including Unison and the UWC and many more, it looks like we could see over the summer and into the autumn a huge wave of strikes right across the board. What does that do to politics? What does that do to the mood of politics?
Well, clearly, look, having strikes, industrial action with the RMT, the workers at Heathrow, it's not good. It's not good for anyone. And I think that the ones that you've mentioned so far, if you take the RMT strike, I think that it's completely unjustified. It is a strike primarily against modernisation but this isn't just about, the issues from the RMT aren't just about pay. I mean, the RMT is against, for example, and this is important just to understand what this strike, the kind of things is about. It is far safer to check rail track today with laser-guided robots. They're quicker and they're much safer per passengers. The RMT insists that workers, humans, have to do it alongside the robot for no reason at all. And we've got to move on with modernisation, and with that you get productivity gains, and when you get productivity gains, then you can afford to pay more.
I'm just wondering, in terms of, this is the one issue that seems to bring your party completely together at the moment. Is this the kind of issue that changes the trajectory of politics? In other words, is this something that the Conservative Party can use effectively ahead of the next election?
I wouldn't phrase it like that at all. It's not about using. I think people are... there's been a lot of division in politics, in both home and abroad. We're seeing it, sadly, and I don't think it's about trying to find wedge issues, trying to put people against each other. It's just about speaking to people, being honest and common sense. And I think what I've said about the RMT, I think, and their reasons for to strike are common sense. I think the average man and woman in the street would understand that you can't have your old dated practices that are holding back productivity, holding back good service, making the railways less safe, and they would expect the government to act.
There's a question, I think, in the middle here. This gentleman here. Can we have a... We have got a microphone here. That's great. Thank you.
Thank you very much. Yes, Secretary of State, I wondered what your view was on how you could apply the levelling up principles to the provision of health care.
Yeah.
And just to mention a specific case, there's an initiative in Clacton called Clacton Place, which is trying to apply those principles to a very deprived part of northeast Essex.
Yeah. Actually, thank you. And actually, I went to Clacton it was a few months back, and I had a public meeting there, and I remember someone mentioning Clacton Place and that initiative. And you're right to pick it as an example, because whether it's Clacton, Blackpool, another place that I visited to look at health disparities, we have huge health disparities in our country, long-standing under successive governments. And it's, as most people I think here would imagine, the sort of poorer the area, the bigger the health challenges in that area, whether it's obesity, it's cancer, it's addiction, drug or alcohol. And this is not something I think any government can stand back any longer and not take it much more seriously. This is, you asked me earlier, it was about something else in health, mental health, personal. This is also very personal to me, as I think if you look at these areas, they just haven't been taken seriously in these disparities. That's why I'm soon, very, very soon, I'll be publishing a health disparities white paper. I've been working on it almost from like the first week I arrived in the department. It's a cross-government paper. I've already done work publicly, some of it, like the Khan review on tobacco, for example, things to feed in to that, and it's to tackle this, and I think it's part of the levelling up agenda. When it comes to, when we think about the NHS, we often, I think a lot of people, at least from when it was formed, think of it as a national hospital service. It's something you go to when you are really ill, but we should be doing much more on either ideally preventing people from getting ill in the first place, or if they are ill, we want to detect it much earlier. And I will give one quick example of how this works, because I think it might be interesting to the gentleman. In Blackpool, I did a pilot study on these lung cancer health trucks. And they literally, as it said, they go and park themselves in a little car park or something, and they invite people, after asking them if they're a smoker, to come and take a lung cancer check, encourage them to take it. The detection rate of early stage lung cancer rocketed from 22% to 75%.
Wow!
Right, that's the and I'm now rolling that out nationally. That's just one example of what we can do and make tackling disparities much more serious.
Sajid, I'm thinking about the work of people like Professor Michael Marmot on differential age of death. I think he was the one who said for every mile you go further east in London, the average mortality level falls quite dramatically. And we know about Glasgow, one of the highest mortality rates for older people in Western Europe, and so on. Are you doing a lot of work with Michael Gove and the Levelling Up Department specifically on these issues, or is this something just inside the NHS?
As part of when Michael published his Levelling Up white paper a couple of months back, this was very much part of it, in that we set out a mission to increase the number of healthy life years and the disparity between the poorer and more affluent areas. I mean, the difference in healthy life years between Blackpool and say Richmond in London is something that is more than 10 years, right? And we can tackle that. It will take time, of course, but it's all very much part of the levelling up mission, because if you are healthier, then you also can stay and work longer, you can earn more for yourself, you can be more productive, so it all pays off. So it's an investment that pays for itself.
So here is an interesting philosophical question, because you are a libertarian, always have been a follower of Ayn Rand and all the rest of it. How do you feel about government initiatives on things like obesity, which dive into people's choice about what kind of things they eat, how much sugar's in the stuff they eat and so on? What's your own personal view?
I mean, first of all, I like Ayn Rand's writing. That doesn't mean I'm a follower of her.
Okay.
I think there's I think there's plenty of people that like her work, but it doesn't mean they agree with her philosophy or all of it. On that particular issue, I think that there are smart ways for the government to change things. And if you take an example, which happened before my time, actually when I was in the Treasury as a junior minister, was what George Osborne did with the sugar tax, which was not designed to raise revenue, but it was designed to encourage reformulation, and it worked. I think if you look at all the studies now, it worked. Now, I'm not suggesting that's the only way to do it, but there are ways to make a difference. So one big thing I've done through the bill that's now an act, the Health and Social Care Act, is the product placement rules, where how supermarkets can place certain products, and if they encourage the eye height of children and things like that. And those rules are coming in October this year as we planned, and that's another example that will make big difference.
And you wouldn't regard that as nanny state?
No.
There's a gentleman over here with the red tie who came up first of all, and then there's two questions there. I know I've been wittering on, so...
Thank you. I work not a million miles from here in a hospital, and I'm sat here because my operating list was cancelled due to lack of beds and lack of staff. Lack of staff due to working conditions, pay and pensions. In the next few years, how will you bring down the waiting list when there aren't enough beds and not enough staff?
We will follow through. Thank you for what you do, and we will follow through on the plan that we set out earlier this year, the COVID-19 elective recovery plan. And the first thing I just think to just recognise, because of the pandemic, the NHS estimates 11 to 13 million people, they estimate, stayed away from the NHS. I think we can all understand why. Those people, we don't know how many of them, but that's let's call it delayed demand. The NHS estimates at least half of those people are going to come back, and they've started to. So we're seeing record demand, whether it's primary care, into A&E and things. So that's one thing that has never happened in our health system before. To tackle that, as well as workforce, which I mentioned earlier, at the highest levels ever, recruiting at the fastest rates ever, we've got to do new ways of doing things. So, for example, if you look at the waiting list, at the moment, the majority of people on the waiting list, and you'll probably know this, so they're waiting for diagnostics, right? They're waiting for scans, tests, and rather than procedures. They may actually not be unwell, as in it might be they go and have their scan, they're actually okay, but the important thing is they need to have that scan and that test. And that's why we have created, for example, already since July, I've created 19 new community diagnostic centres. We've got another 70 to come. Between them, they'll do 9 million test scans and procedures a year, taking pressure away from the rest of the NHS. So that's one new way. The surgical hubs that we're opening up in hospitals like Moorfields, the surgical hub now for cataracts, which is the #1 surgical procedure that people wait for. So that's helping. They're seeing twice the number of people compared to before the hub. And so we will work our way through the waiting list that way. It will take time, of course, but it's working. In the people waiting the longest, 2 years plus, in February I said that we will get that down to zero, virtually to zero by July, and we're on target to do that. So next month we'll get that down to zero. It's not easy, but we are doing better than any other part of the United Kingdom, any other nation. As you know, the NHS is run separately, and we're going to keep ploughing away.
Don't tell Nicola Sturgeon, who is announcing her next India F plans this afternoon. Now, there was somebody at the back there, I think. Can I?
Hello. There are reports swirling that some 2019 intake MPs are talking to Labour about defecting. Are you worried at all about Tory defections to Labour?
Look, I've seen reports similar to that, I think, for the last 6 months. And apart from the one defection that everyone knows about, nothing else has happened. So I have no idea if they're accurate or not, but I'm quite sceptical about what I've read.
Next question. There's a question there as well. Thank you.
Thank you, John Pearson. You've used this afternoon what I think is a traditional Tory response to questions about commitment and expenditure, which is to roll out a 2022 number of pounds when the deficits in the National Health Service started 12 years ago with austerity, unnecessary austerity under Cameron and Osborne. Would you dissociate yourself with what I believe for many years has been a secret agenda to run down the National Health Service to the point where you could overcome its popularity with the population in order to privatise it?
No, because with respect, I don't agree with, I think, anything that you just said.
This is not the House of Commons. Let him answer.
Where you can get away with misleading.
No, let him answer. All right, let him answer.
Better than you have so far.
Well, as I said, with respect, I disagree with everything that you said, and I'll explain why. You said, first of all, what you called austerity with the government back in 2010, the coalition government trying to bring spending back under control, I think was necessary to protect the public finances and to get the economy growing again. Secondly, the actual spending in real terms on the NHS is the highest it's ever been under the long-term plan that was set out by Theresa May. So before the pandemic, with the spending increase in real terms that was programmed, it's a real-term spending increase. That was the highest annual increases the NHS has seen in at least a decade. And with the spending review that was completed last year, we're continuing to see that level of investment, and this is in real terms. In fact, by 2024-25, so basically towards the end of this Parliament, the day-to-day spending of the NHS will be around, I think, 44% of what's called RDEL in Treasury speak, which is basically the day-to-day resource spending, so the non-capital spending. That's the highest ever. Back in 2000, when there was a Labour government in charge, as I remember, spending then was around 23-24%. And so even if you judge by percentage of total government spending, it is the highest levels ever. If you judge by real spending, it's the highest levels ever. So I just think your facts are just wrong, and you should be quite open-minded to yourself to accept facts and not just stick to some stuff that you've read somewhere else.
Can I ask you about something related to that, which a lot of people think about, which is when the national insurance increase came in, we were told that was really to fund social care, but a lot of money would be going to the NHS under particular circumstances of the pandemic, and they would revert to social care. And there's a general suspicion that the NHS will swallow the lot. So what proportion of that money is going to be actually going to social care by the end of this Parliament?
Of the total, if you're referring to the levy, I think that's what you're referring to.
National insurance.
So of the total funding that was committed at that time, it's around 34 billion pounds over a 3-year period. Approximately, actually 5.4 billion of that will be going to social care, and that hasn't changed. 5.4 billion will be going. It is true what you've just said in the early part. So the first year is roughly the same amount that's raised each year. In the first part, the first year especially, but partly in the second year, or more proportionally than later years, is going to NHS and health spending.
All right, question, gentleman here. Sorry, and then you.
I'm assuming you're a free marketeer. I mean, because you're a conservative, you're ideological. So can you tell me why you wouldn't spend more of the NHS budget in the open market, in the free market? Or are you just trying to sort of obfuscate that point?
What
because
do you mean,
ideologically, surely you must think that it would be better to spend it in the free market. Ideologically, why are you, as a conservative, as a right-wing conservative, supportive of the NHS in the public sector?
Oh, why? I think.
Why?
Okay. I understand your question, sir. Thank you.
Because it seems illogical to me that you would be.
No, it's not. It's the NHS from the values I referred earlier to the values of the NHS, like what I call the 1948 values, and those values of having a national, publicly funded health service, funded out of general taxation, so free at the point of use for everyone, and to meet their health needs. Those are values that I support. I've always supported them. And one of the reasons, if you're interested, like why I've supported them, because I've relied on the NHS. My family has relied on the NHS, my parents, and it's been there. And I also think it's the mark of a compassionate society that we all sort of, we all chip in effect, through our taxes, and we help support each other with which is one of the most basic needs that we all have, which is our health needs. Now, that said, I think we have to recognise that the situation is very different from 1948 in terms of health needs, because our demographics clearly are changing and still moving rapidly. The burden of disease has changed as well, the kind of things that we're, much more cardiovascular disease, for example. We know much more about cancers and things. And there's a lot more treatments and medical breakthroughs than ever before. And that's increasing, thankfully, at a big pace. So that means we've got to keep moving with that and making sure the NHS can provide those. And that's why earlier when we were chatting, I think that's what I mean about the modernising the NHS, to make sure that because of these changes that are happening across the world, especially in large industrialised economies like ours, that we keep the NHS moving and looking ahead to how it's going to meet our needs in 2048, and not just sort of stuck in some practices that haven't modernised.
So you are definitely committing not to spend a bigger percentage in the private sector underneath the NHS banner.
I'm not sure I understand that part of your question, sir.
I think the answer is no. I'm afraid we have completely run. I'm afraid we have completely run out of time. I know there's an awful lot of people who want to ask questions, and I apologise for my verbosity. But I have to say thank you very much to our guest Sajid Javid for answering questions.